Hello, my name is Lillian Schmitz, and the date is May 23rd of 2021. On the back of my note card here, I just have my terms to follow along with for this presentation. So today I dissected a pig kidney. So we've got our kidney right here. It's cut in half so we can see in the inside of it. I'm going to be going over the parts of the kidney. So first we have our renal cortex. So that is going to be this lighter part surrounding the kidney on the most superficial part. So that's our renal cortex. If we look deep to the renal cortex, we'll see that it gets a little darker here. And this is going to be our renal medulla. So the renal medulla is going to be divided into pyramids, renal pyramids. So if we look closely here, this is a renal pyramid right here with the base bordering the renal cortex. And the tip is right here. So we can see the tip of the pyramid is right here. So the renal pyramids are divided from each other by renal columns. So we see this white tissue here is going to be the renal column. And you can see here there's renal columns adjacent to each side of the renal pyramids. So a kidney lobe will consist of the renal pyramid and the surrounding tissue, including those renal columns. So that will be a kidney lobe. So deep to the renal medulla is going to be the renal sinuses. So you can see like these openings here. These are the renal sinuses. This is where blood vessels, nerves, lymphatic vessels, and the ureter are going to branch. So they'll branch within the renal sinuses, those openings within the middle here. So then the renal ileum. This is the indentation on the medial surface of the kidney. So the medial surface, we know this is the medial surface. We know that the renal ileum is going to be on the medial surface here. So it's just this indentation here and right here. And this is the entrance for the renal nerves and the renal artery. And it's also the exit for the ureter and the renal veins as well, or the renal vein as well. So next we're going to go kind of down the pathway of urine. So again, we're going to go to that tip of the renal pyramid here. And what's going to happen is that is going to drain out into these minor calyxes. They're very hard to see on this, but just at the tip of the renal pyramid here, urine will drain out into the minor calyx or minor calyces if we're talking plural. So the minor calyces will then merge to form a major calyx or major calyces. And then these major calyces are going to merge further to form the renal pelvis. So the renal pelvis is going to be this portion right here. And the renal pelvis is connected to the ureter. So if we can find our ureter, here it is. So it's this opening right here. This is the superior portion of the ureter. But this is where the renal pelvis is going to drain into the ureter. That is the dissection of the pig kidney and the information I have. Thank you so much for listening.